Could you please discuss the impetus and the background for the study?
Sure. So prior to the COVID-19 pandemic, telemedicine was just emerging as a kind of a new modality of healthcare delivery that was just starting to be used more widely in children. At Boston Children's, we actually had implemented our telemedicine program in the fall of 2017. And we did a pilot study showing that it was feasible, meaning that neither patients nor providers really ran into technological issues. And we thought, we can do this. So as we started using telemedicine more widely, we decided the next step was really to show that virtual visits are as safe as in-person visits and that families were equally satisfied with their care. So that was the initial impetus for starting this study. And then we also decided that we wanted to evaluate the costs of telemedicine compared to conventional in-person visits, as we know that telemedicine can reduce the need to travel to appointments, which then can decrease time as well as the monetary costs associated with visits. So we wanted to look at all these things in our study.
And what were some of the notable findings that came out of the study?
I think the most remarkable finding is that the travel and waiting for care for an in-person visit was 98.4% of the total time spent for the visit. So this is not a small amount of time. Families spent over 4 hours for 4 minutes with a surgeon. In other words, they spent 1 hour to gain 1 minute with their surgeon. Meanwhile, the virtual visit experience took 15 minutes total for 5 minutes with their surgeon. So that's only 1/3 of the telemedicine experience compared to 3%, really less, 2.5% in the other study. Also, I think another thing that goes along with this is that remarkably less children and parents missed school activities and work respectively for the virtual visits. And this made us decide, what is the opportunity cost of doing an in-person visit versus a virtual visit? And this is based on a calculation of foregone activities. And we estimated that the median opportunity cost for an in-person visit was $100 compared to $0 for a virtual visit. And if you take into account lost productivity of coworkers due to a parent's absenteeism from work, it actually increases to about $150 per in-person visit.
Were there any other findings that came as a surprise to you and your co-authors?
I think, as I already mentioned, a FaceTime of 4 or 5 minutes with a physician was surprisingly short. I think it just goes to show how efficient and quick these postoperative visits are, which make them a perfect use case for telemedicine. We're seeing these established patients who, require just an expedited visit, and they're served very well by telemedicine, and they save a significant amount of time and money, as I already said. I think the other thing that's, not surprising, but worth noting is that whether it was telemedicine or an in-person visit, all families were very satisfied with their postoperative care, and I think that's important.
What was your own volume of telemedicine usage in your practice prior to the COVID-19 pandemic and shutdown? And then what is it like now?
So, as I said, we had started our program in the fall of 2017. We had slowly ramped up, but we were seeing about 20 to 40 virtual visit patients per month prior to the pandemic. Then at the start of the pandemic, we started to see 20 to 40 per week. And by mid-June, we were seeing 280 patients virtually in 1 week. So we essentially, during the pandemic, replaced our full in-person practice with virtual visits.
How difficult or challenging was that transition, and for both for yourself and for patients and their parents?
Yeah, I think there's learning curves for both parties. For clinicians, doing a telemedicine visit, this virtual communication, or what we have termed as webside manner, may require some modifications to what we traditionally do in our in-person bedside manner. And I actually did some research to kind of explore this aspect of things, speaking with a diverse group of pediatric providers at Boston Children's, and we found that really provider comfort, their confidence, and their flexibility with telemedicine technology was critical to their success and their feeling about their telemedicine visits. And a lot of this takes practice. For instance, focusing on the camera rather than looking at the picture of the patient, so it looks like you're making eye contact instead of looking down. And that takes practice to get used to for clinicians. But I think the more that everyone does, and by the end of the pandemic, everyone's had a great deal of experience with it. I think the same goes for patients and families. in the start of things, maybe with their first visit, providers have to spend some time with education and, getting them to show what they need to show of their child so that the provider can have a good enough physical exam. And we found that, for the most part, with our children, about 80% were satisfied with what we've seen over the virtual visit, and it's good enough. And, about 20% things like hypospadias or other things that are just more difficult to see virtually, they might need to come into the office. But I think for the most part, what the families are able to do is good enough for us.
Is there anything else that you think practicing urologists should know about the study and your findings?
We performed this study prior to the COVID-19 pandemic. A lot has changed now with everyone using telemedicine a great deal more. But I think since people are using telemedicine more, it's important to think, how do we sustain telemedicine and integrate this into our practice as we get back to work? One thing to note is that at the start of our pilot program, we were using telemedicine kind of throughout the day. We would try to schedule patients, and we heard from families that they really preferred to be seen at the start of the day and at the end of the day, either before work, after school. And we were able to kind of set up our schedule so that we can see patients between 7:30 and 8:30 or 8 to 9 in the morning before our clinic day, and same thing towards the end of our day. And we found that this was mutually beneficial for the provider as well as for the families. So that's one thing I would suggest. And then the other thing is to think about, which patients can still be seen via telemedicine after this pandemic. And I think our study shows that post-operative patients are the perfect use case, as I said earlier, and that most of these patients should really continue to be seen via virtual visits after the pandemic.